Namaste and welcome. Today we are going to discuss a very important topic, mind-body connection. So what we are going to discuss and experience today, is this just a cliche or is this something that simply sitting in your own room, you can experience and appreciate the mind-body interaction? How mind affects the body and how body affects the mind. शरीर और मन का क्या संबंध है, इस विषय में विचार करेंगे और अनुभव करने का प्रयास करेंगे इसकी सच्चाई का. So just a couple of days ago, let me discuss a case with you. We begin with that. A gentleman came to see me, multiple problems, lifestyle disorders, heart disease, blood pressure, cholesterol. But what really caught my attention was diabetes. His hemoglobin A1C was 12, which I think, as you know, is extremely high. So I started going through his records and history. And the first thing I looked at is his medicines, and he's taking very good medicines. So we talked further, and I said that the problem with the diabetes lies somewhere else. And he was taken aback and he said, look, over the last 5 years, I've seen 10 different doctors. I've seen endocrinologist also, diabetes specialist also. And I said, yes, you're right. And I'm taking medicines, and I looked at his medicines. He's taking metformin, he's taking glipizide, he's taking vildagliptin, he's taking empagliflozin, all good medicines. He said that, look, you're the first one that told me that there's a connection between the mind and the pancreas and diabetes. He said, I read this and my doctor told me that diabetes happens when there's a problem with the pancreas. And I said, yes, you're right. He said, my doctors told me it has some connection with pancreas not producing insulin. And I said, yes, you're right. He said, my doctors told me that these are the medicines that you take, which I'm taking. I said, yes, you're right. He said, the doctors told me the precautions you should take, exercise, diet, what to eat, what not to eat, and I'm doing that. And I said, that's right. And he said, you're talking about the mind here. And I said, for now, please accept that I'm also right. So I said, tell me, since when did you notice your hemoglobin A1C jumping to 12? He said, about 3 years ago. I asked him, anything changed in your life 3 years ago? Anything? And he was stone-faced. He probably did not want to discuss, or maybe he knew that if he discussed something, this is going to create a storm of emotions in his mind. So he was quiet. And suddenly his wife burst into tears. And here's what she told me. He had a son, a young man, who really was a nice boy, helped him with his business and shop and everything. 30 years old, gets fever for 4 days, and then dies despite treatment, suddenly in 4 days. Within 4 days, son's wife, their daughter-in-law, with their grandbaby, loving grandbaby who they were very attached to, goes away to her parents' family. For reasons unknown, she refuses to keep contact with them. And then he belongs to a certain community. And in that community also, people started whispering and murmuring and gossiping, and all that was negative. So these three affected him so badly, he said, that since then, he was lost. And that is when he noticed that his hemoglobin A1C has been climbing up. And despite medicines, exercise, activity, diet control, it did not change. And that is when I told him that other than everything else that you know about diabetes, you should also know that your mind and your stress has tremendous capacity to keep your sugar elevated, no matter how much you try to bring it down with medicines, diet, activity, etc. So before we explore this mind-body connection further, well, one good thing is that he agreed that he will work with me and we'll do the program and get him into everything. And hopefully we will come to some good news. And he promised that he'll do the program, and in 3 months, we'll report his hemoglobin A1C again, and I'll share that with you. So before I go further, let me discuss something very simple with you. Understand A, B, C. Simple. In this context, the ABC stands for A for awareness, B for breath, and C for calmness. In other words, it is possible through awareness and breath, you can get calm. Breath is a bridge that connects the awareness to calmness. What is awareness? We all have a mind which has a default network, which is based not in safety, but based in fear. Many years ago, just like animals, we were also in jungle, and constantly there were threats to our living being. Constant threats instilled in us a fear, and that fear evolved a concept in our system, a concept of nerves, hormones, and certain chemicals, which is called sympathetic nervous system. This is the flight and fright reaction. There is fear, you get scared, you got to run. To run, you need to do this. You need to dilate your pupil, you need to save energy, you need to push up the glucose levels, you need to increase the heart rate, you need to increase the respiratory rate, you need to increase the contractility of the heart, etc., etc., etc. And all that takes you into fight, flight, fright mode. And as this evolved, there was a balancing system called parasympathetic nervous system that got suppressed. And that is calm, collect, rest, repair, rejuvenate, safety, etc., etc. And that is the one that is activated through vagus nerve. So if you can increase the tone of the vagus nerve or the vagal tone, you go from a fight, flight, fear mode to a relaxed, safe, calm, quiet, rejuvenating, repairing mode. So all the body organs that are being damaged by the uneasiness and stress of the mind start healing. Now, because this was an evolutionary concept and has stayed with us, you have to understand that this got the urgency and the relaxation got the backseat. So the way the neuronal firing is working in our brain, it only takes 3 milliseconds for the fear center to react, but it takes 300 milliseconds for the center of calmness to react. The fear resides in the lower brain, we call amygdala, which we share with the animals. And the safety lies in prefrontal cortex, that is evolved mind, higher mind, that is present only in humans. Now, the fear mind, you don't need to develop. It is already developed in us. It's the safety mind, the higher mind, the prefrontal cortex That is the one that you need to evolve. Now, which one do you belong to? Very simple test. Just do this very, very simple test with yourself. There are some people who take great pride in saying, and that is how they live a life, and they say, अरे साहब मस्त हैं हम, जो मन में आया, जो सोचा वो कर दिया. And say, wow, such a great man, what a life you have. जो मन में आया, जो सोचा वो कर दिया. And this is somehow appreciated, right? This is animal mind. This is lower mind. This is instinctive mind. This is a mind that works without awareness. And this is the mind that can lead to all the problems in the body. As opposed to, हम सोचा और किया. I thought, I gave it a consideration, I paused, and then I acted. This is a reason mind. It's a reason response, as opposed to the earlier response, which was a reactive response. So find out for yourself which group do you belong to. And for us to shift from automatic, autopilot, fear mind to a evolved, higher reason mind, which gives you safety and healing, it is a cultivated process. And one simple way of doing that is through breath. Through breath, you activate vagus nerve, and that percolates calmness into the body. And this calmness, when it comes to the body, is what makes the body heal. Now, the science is more and more beginning to understand that intelligence does not just reside in this skull, in your mind. Every cell of your body has cellular intelligence. It's amazing what goes on, the processes that go on within a cell in terms of manufacturing, distribution, collection, storage is greater than any big complex, for example, export zone or a business zone in the country. There are multiple factories, right, in a business zone. All of that exists in just one cell, and that cannot exist without that intelligence. So this transmission of the awareness from your mind to your cell is what heals. And there's a connection between this. There's a bridge between that. And that bridge is your vagus nerve. So we'll expand more on that. Those of you who have done some yoga with different yoga instructors or gone to some yoga retreats may have heard a beautiful shlok or a sutra from Hatha Yoga Pradipika, which is Chale Vate Chalam Chittam Nischale Nischalam Bhavet. So I'll translate. When the breath moves, the mind moves. When the breath becomes still, the mind becomes still. So see how astute observers they were. They had no concept of vagus nerve. They did not know sympathetic, parasympathetic nervous system. They did not know acetylcholine, the transmitter of the vagus nerve that brings in this calming influence in the body. But they knew the practicality of it. Okay? So this is a very simple thing that let's just meditate on that for 2-3 minutes. So how we're going to meditate on this? Sit down, relax, comfortable posture where you don't have to move. Okay? All you have to do is keep slowing down your inhalation and keep slowing down your exhalation as much as you can do comfortably. So you're going to breathe in and breathe out. Slow down, breathe in, breathe out. Slow down more, breathe in, breathe as you're doing this, I really want you to repeat in your mind when you're breathing in, you say, move the breath, move the mind. When you breathe out, you say, still the breath, still the mind. So here's I'm doing it. But when I'm doing this, when I'm inhaling, in my mind, I'm repeating, move the breath, move the mind. When I'm exhaling, I'm repeating in my mind, still the breath, still the mind. Right? In Hindi, those who want to do this meditation, they'll say, सांस तेज तो mind तेज, सांस धीरे तो mind calm, a mind धीरे. So let's see if you want to do that and how you practice and what you feel. So sit down, relax, close your eyes, gradually go on slowing down your inhalation and exhalation. You can very easily, normally you breathe 14 times a minute. Anxious people breathe 20 times a minute. You can very easily, safely take it down to 7 breaths a minute without noticing any problem. With practice, you can take it down to 5, 4, 3 breaths a minute. So let's do that and see how we experience. Dr. Shashank, can you put a 2-minute clock? So breathe in. And as you're breathing in, you're saying, move the body, move the mind, move the breath, move the mind. And as you're breathing out, still the breath, still the mind. So you're going to keep repeating this cycle in your mind. Gently open your eyes. So put that in the box. How many of you were able to gradually go on and keep slowing down their breath? कितने लोग सांस को लेना और सांस का जाना धीरे 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 कम कर सके थे. How many of you were able to repeat the mantra in your mind? Move the breath, move the mind, still the breath, still the mind. And how many of you felt relaxation? इसको शेयर करिएगा. ठीक है. So this is a very profound, simple breath focus meditation where you gradually slow down inhalation and gradually slow down exhalation to minimum as possible and keep it for as long as possible. And this is a profound way of increasing the vagal tone, the tone of the vagus nerve that heals, and we'll discuss further how that heals. So this mind and body connection we learned is through vagus nerve. We should think of this vagus nerve as serving three purposes. Number one, it is an information superhighway, in the sense that very fast it takes information from the mind to the body, and it also takes information from the body to the mind. So those of you that know neurophysiology will also know that actually 80% of its job is to take the information from the body and give it to the mind. And 20% of the neuronal firing is to take the information from the mind to the body. So how does it take information from the body to the mind? Simply through sensors, which we in our language of physiology call receptors. And these sensors are located in various areas. You can really think about it. If you have ever gone in a big building or you've had some alarm system installed in your home, they come in and they put sensors in various rooms. One right in front of the door, one in your bedroom, one in your drawing room, one in your living room, one in your dining room, etc. And all these sensors are picking up. If there's any movement there, the camera becomes on and they see what's going on and they perceive, right? It's exactly like that. There are receptors all over the body, and these receptors, these sensors pick up signals. For example, there are receptors here in the carotid. They are stretch receptors. When the carotid artery expands because there's more heart rate or more blood pressure, the sensor senses it, sends it to the vagus nerve, takes it to the body. So all these informations are going to the mind like that through this superhighway. It also sends information down. And when it sends information down, it also releases certain chemical. It's called acetylcholine. Chitta prasadam, I call it. This is the substance that improves your metabolic activity, improves your immunity, reduces the inflammation in the body organs. This is all through acetylcholine pathway. So it's taking information up and it's sending the elixir down. The elixir is acetylcholine. Now, in doing so, it is also a bridge, right? So if the mind has to talk to body, it has to go through this bridge. It is also the brake system that we'll discuss later. Okay? All right, so let's move forward. Mind controls the body, I said. Is there a way to experience it right now? Well, those of you that are wearing a smartwatch can do this, but if not, you can do it at a convenience later. What you do is you check your blood pressure and write down. And then you check your heart rate and write down. And then you do what I'm asking you to do now, which we'll discuss. And then 5 minutes later, you again check your blood pressure and again check your pulse. So what you'll find is through slowing the breath, firing the vagus nerve, taking it to the mind, you relax the whole body. So this is how mind lowers heart rate, mind lowers blood pressure. So this will be your first experience, real experience in your life that yes, the mind controls the body, because blood pressure, heart rate, this is a body function, okay? So the trick to this is you not only slow the breath, but you slow the exhalation more than the inhalation. अगर अंदर लेने में आपने गिना 1 2 3 4, तो निकालने में गिनेंगे 1 2 3 4 5 6. So breath in. So when you're breathing in, you count mentally 1 2 3 4, and then you're out 1 2 3 4 5 6, and then you're going to slow it down 1 2 3 4. सांस अंदर लिया, breath in 1 2 3 4 5 6, सांस बाहर किया. So this is 4 to 6 ratio between inhalation and exhalation, and slowly slowing it down, slowing it down, slowing it down. Okay, so we will do a very short 2 minute on this. Relax, sit in a comfortable position. ठीक है, आराम से बैठिए, आंखें बंद कर लीजिए, धीरे धीरे सांस अंदर लेंगे. We'll take slow breath in and count mentally 1 2 3 4, और फिर निकालेंगे 1 2 3 4 5 6. So I'm going to guide you initially, and then I'm going to be quiet, and we are doing it mentally. Okay. So let's begin the meditation. Take a breath in, breathe out, breath in, breathe out, breathe in, breathe out. Now we're going to begin. So start taking a breath in. 1 2 3 4. Let's start breathing out. 1 2 3 4 5 6. Breathe in. 1 2 3 4. Breathe out. 1 2 3 4 5 6. Now keep doing it in your mind and keep slowing down 1 2 3 4 of the inhalation and slowing down 1 2 3 4 5 6 of the exhalation. Let's do that for 2 minutes. Gently open your eyes. So I hope you were able to coordinate this counting with the breath, 4 with the inhalation, 6 with the exhalation, and you are also able to slow it down. Now you can do this experiment at home later and check your heart rate and blood pressure before and after, and you see the difference. So that will be your first experience in life that will convince you that when the breath is slowed, the vagal tone is increased, the information is sent to the mind that I am safe. Then mind controls the body by lowering the heart rate and lowering the blood pressure. All right, so mind controls body, fine. Does body control mind? All right, let's experience that. Is it possible? I told you that mind and body are connected through the superhighway called vagus nerve, and it's bidirectional. So we experience the mind controlling the body. Can we experience body controlling the mind? Well, let's do that, okay? And what I want you to do now is to sit straight, okay? And put one hand on your chest, left hand, and right hand on your belly. एक हाथ छाती पे रखिए, एक हाथ पेट पे रखिए. So what you're going to do today is a very awkward breathing. जैसा आप करते नहीं हैं. And it is called abdominal breathing. When you breathe, you will make sure that the lower hand comes forward. So that what you're doing is your diaphragm is going down and the belly is coming forward. But the chest should not come forward. Normally, हम chest से breathe करते हैं. Normal breath is chest breathing. This is a different breath. This is abdominal breathing. So it looks something like this. See, I'm breathing. You may be able to see my stomach or my belly or not, but you just can see my left hand on my chest and it is not moving. So this is called abdominal breath. सिर्फ पेट फूलता है, छाती नहीं फूलती. All right? So we're going to do that for a count of 12 breaths. As slow as possible. Slowly in, slowly out, slowly in, slowly out for 10 breaths. Let's do that. Begin now. Close your eyes. Breathe in. Push your stomach out. Breathe out. Let the stomach go down. Make sure the chest doesn't go up. Gently open your eyes. So this is a very profound pranayama and meditation. Those of you who felt calm in mind after doing abdominal breathing, please share that. Okay. Sometimes you may need 3, 4, 5. Some of you who are not able to calm down because the process is complicated, you're doing it for the first time. So that may be the reason why you did not get the full effect. Right now, the whole process may have appeared contrived to you with an effort and making sure I'm doing it right. But once you keep doing it and you become adept at it, you will see it's one simple continuum and it's beautifully calming. So again, what we did here, when we slowed down the breathing, we immediately conveyed to the vagus nerve that everything is fine. I'm safe. I'm safe. When the vagus nerve found out that you're safe, it sent the signal to the mind, and the mind sent the signal down to the body saying, okay, if you're safe, my dear, you don't need to breathe hard. You don't need to increase your heart rate. You don't increase your blood pressure. You don't need to increase your glucose because you're not running away anywhere. You don't need too much sugar in the body. You don't need to increase your immunity. There is no infection coming. So you lower your inflammation, you heal your pancreas, you heal your gut, you heal your stomach. Okay? So the secret is in slowing down. If you really, some of you must have noticed this, I'm sure, because when you read Bhagavad Gita, that's the last thing you focus on is pranayama. But there are one or two references to that. And again, it says, pran apan gati rudhva pranayam parayane. So pran apan, inhalation and exhalation, gati rudhva. The speed should be slowed down as much as possible, pran apan parayane, to the extent that it appears that the process of inhalation and exhalation is so rhythmically and beautifully musically aligned that it appears just one continuum. ब्रेथ का अंदर जाना, ब्रेथ का बाहर आना एक लय में ऐसा लगता है एक ही प्रोसेस है, and that is what calms down the mind. So now you saw this is diaphragmatic movement is a body movement and how it calms you down. Now, you can also do this with another awareness, and that awareness is what sits in your belly. You will be amazed that between your diaphragm and your pelvis, in this abdominal cavity, is just about everything that causes lifestyle disorders. Where is the seat of your diabetes? In the pancreas. It's in your belly. The seat of cholesterol is in your liver. It's in your belly. The seat of inflammation is in visceral fat. It's in your belly, right? And you will be amazed that this vagus nerve that goes in the brain and then in your gut connects the brain to the gut. There are two areas in your body where there is highest neuronal expression, the highest amount of nerve network. One is obviously here in your mind and the other is in your gut. And that is why some people now call it second mind. So your second mind is in your stomach. Way back, I tell you this interesting story. When I was a medical student, I used to be very upset when patient used to come to me. It does not matter what their bodily ailment is. They always begin with their पेट साफ, भूख साफ, साफ नहीं हुआ, पेट अफरा हो गया, abdominal distension, indigestion problem. And I used to say, why is everybody so focused on their abdomen? And then I migrated to England, and when I went there, so constipation is a very big problem in England. And my initial postings were all in geriatric with the old people. And one constant complaint, constipation. No matter what, heart attack ho gaya, they're not talking about chest pain, shortness of breath, sab pet saaf nahi. They're not talking about what happened to the heart. And this used to upset me. And I said, and when I'm learning medicine, right? So I think this is nonsense. Now I have to realize that is where the second mind is. There's a profound influence of your gut to your lifestyle illnesses. Gut-brain axis. Someday we'll talk about that. All right, so this vagus nerve I told you begins from medulla, which is the base of the brain. There are two nerves coming down on two sides, one on the left, one on the right. Goes down. So when it goes down, it's supplying part of the eyes, front of the ear, inside the ear, areas of your mouth, your voice box, your larynx, your chest, lungs, heart, diaphragm, and then go down into the organs, the liver, the pancreas, the intestine, the stomach, the anus, the uterus, the ovaries, the bladder, the kidney, urogenital system, gastrointestinal system, reproductive system, cardiac system, pulmonary system. All right, so think about it. All these super specializations that are happening in India these days, right? Gastroenterologist, hepatologist, pancreatologist, endocrinologist, reproduction specialist, urologist, cardiologist, pulmonologist, all these organs in which they are specializing for specific derangements or disorders of that specific organ, they all have vagus nerve innervation, bidirectional. Their information from these organs is going to the mind, and a solution is coming from the mind. So all these organs can be repaired to some extent by mastering the vagus nerve. So it's the super specialist of the super specialists. So right from here to here. Now in a program, we do, when we do the yoga, we do the eye massage. So what happens, you do this, warm your hand, and you put them in the eyes. This gentle compression of the eyeball, that is enough to stimulate vagus, and that is increasing your vagal tone, and you're getting the benefit. We chant Om. So what happens when you chant Om? Why? Om gives you tremendous. So please, don't belittle Om. So don't think that what I'm talking about right now is physiology, physics. I'm not talking about metaphysics. There are tremendous metaphysical benefits, the spiritual benefits of Om, and we're leaving that aside because I am not qualified to talk about that. But I'm talking about not the metaphysical, but the physical benefits of chanting Om. When you chant Om, what you do is you create vibrations in this area in your voice box. So this larynx has very high innervation of vagus nerve. So when you chant Om or you do Bhramari Pranayam, you're creating vibrations, and these vibrations are picked up by these nerve endings of the vagus nerve, and the vagus tone increases. And that is why after chanting Om, you feel so relaxed. And that is why after singing, you feel so relaxed. And that is why after laughing, you feel so relaxed. All these things that you do increase the vagal tone. And then I told you by slowing breath. Now, in our carotid arteries, there is a high concentration of sensors. There's a very big sensor on each side. And some of you who may have had a condition called tachycardia, they go in the hospital with rapid palpitation, the cardiologist massages here. It's called carotid sinus massage. And boom, the rhythm is normal. What was that? The stimulation, constant stimulations increases the vagal tone. Vagal tone suppresses the pacemaker, the heart rhythm, and restores the normal heart rhythm. This is how profound it is. And now there are studies going on. The scientists found out that there's actually, other than the practices that we are discussing, you can also do vagal stimulation through a pacemaker and a nerve. You just bring it close to vagus and keep firing it. so that the vagus always stays in tone. And they've noticed that just by doing that, you can improve the heart failure in a heart failure patient. And there are special pacemakers being generated. There's some research going on right now. Same way coming down, we do this, all these meditations, these pranayamas for the diaphragm that we do. Chest movements that we do. Every time we move chest, because there are mechanoreceptors or the mechanical sensors in the chest wall that stimulate the vagus nerve. There are receptors in your respiratory passages called bronchioles. There are sensors in the lining of the lung called pleura. And that is why, you keep breathing, keep breathing, keep breathing. Why don't you just keep breathing and rupture your lungs? Because there's a receptor there or sensor there which says, okay, you've breathed enough. And it sends a signal to the brain, and the brain says, stop breathing. Even if you don't want to, the breathing stops. Herring-Brewer reflex, right? Some of you are doctors may have read that in physiology. So, in a nutshell, all the way from the eyes down to the pelvic floor, all the way down to your anus, we do Moola Bandha. Moola Bandh, Uddiyana Bandh, we do, right? Jalandhar Bandh. So Moola is at the bottom of the pelvis. If you tighten the muscle in the pelvis and pull it up the base of the anus along with it, intense vagus stimulation happens. Now, some of you may have noticed the overstimulation of vagus with micturition. Some people, when they go to the bathroom, if the bladder is full and they micturate, they pass out. So what is happening there? Intense vagal stimulation that happens once you evacuate the bladder, and that results in drop in the blood pressure and pulse rate, and they pass out. So this is how profound it is, how strong it is. All right. So the innervation I told you, larynx, heart, lungs, and all the organs in the body. So think about it. The pancreas, the seat of diabetes, right, is in your belly, and you now know, innervated by vagus, you can modulate that. Cholesterol in your liver, you can modulate that, lower your cholesterol. We already told you in the blood vessels, there are sensors for the vagus nerve. You can control your blood heart rate. You can control your blood pressure. And also in people that keep vagal tone high, I told you it's a bidirectional thing. The acetylcholine that comes down, right? The prasad, the nectar that comes down through this nerve, coming down into the blood vessels, it's circulating all over the body, and it is a very good stimulant of nitric oxide, which opens up the blood vessels. People with blockages, they take nitrate. When you have chest pain, the doctor gives you nitroglycerin, lift your tongue up, put it under the tongue, and it dilates the blood vessels, right? What is that? It's basically releasing nitric oxide that makes the blood vessel relax. And this is your endogenous natural nitric oxide that's released in response to the acetylcholine that comes from increase in your vagal tone. So if your vagal tone is high, you should get less angina attacks, right? If your vagal tone is high, you should get less arrhythmias of the heart, less extra heartbeats, less atrial fibrillation. If your vagal tone is high, your heart failure should get better. You should be able to improve your respiration, breathing, and chest pain and all that. All right. Now, I told you the break, right? So the sympathetic nervous system is what charges you to run, right? Fight, flight, fright. And I told you vagus is relax, tend, befriend, relax, safety, calm down, relax, repair. So with the danger comes sympathetic stimulation, which gives you stress, right? So the sympathetic stimulation, if you think of the body as a car, then the sympathetic system is the accelerator. So a stress comes in your life, whatever stress comes in your life. And we get stressed every day in our life. Now, how do you perpetuate the stress? You perpetuate it by ruminating on it. What is rumination? Jugali karti na cow. Cow gets food in the mouth, goes in the stomach, brings it back, and keeps juggling in its mind. It's called rumination. So you ruminate the thoughts. There's a stress, something happened. The trigger is done, gone, damage done, but you're playing it in your mind. Why did he do that? He should not have done that. What have I done to deserve this? Why is this only happening to me? Why does he not love me when I love that person? Why did he shout at me? Round, 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 round. What are you doing? You're pressing the accelerator. Every time this thought comes, you're pressing the accelerator. You're stimulating the sympathetic nervous system more and more. And what is it doing? It's increasing your heart rate, blood pressure, cholesterol, sugar, heart blockages, heart disease. Who is doing it? Who is making the blood sugar go up? Every time you think about something that happened to you that should not have happened, you're accelerating. You're putting the accelerator. Or the barrio. The car that was running at 30 miles in an hour is now running at 40 miles, then 50 miles, and then 60 miles. And the more you accelerate, what is happening? Your sugar is going up 120, 140, 160, 180, 200. There's so many patients that come in and they say, I wake up in the morning, sir, kuch nahi khaya raat ko. I wake up in the morning, sugar 170. They had all this stress going on the mind, could not sleep well, tossing and turning in bed, waking up with accelerated sympathetic system, sugar is high. What is diabetes medicine going to do there? What is insulin going to do there? There's so much that the pancreas can do. There's so much the medicine can do. But you're yourself. It is like from one side, you're throwing water on the fire, and from the other side, you're throwing ghee, fat, oil on the fire. Can you extinguish that fire? No. No, you cannot. So when you only treat diabetes with elevated sugar, with medicines, you're putting water on the fire. True. But if you are stressed out and you're not taking care of that, right, and not calming down the body and the mind through the vagal tone, you are putting oil on the fire. It'll never extinguish. So vagus is the brake. It gives you safety, calmness. When the safety and calmness happen, acetylcholine comes down. It heals the body. Okay, good. So we found out that if you accelerate, you cause problem. If you slow down, you find the solution. So you can, in your mind, create a very simple mantra. And that is run the mind, wreck the body, rest the mind, repair the body. Very simple. Run the mind, wreck the body. If the mind runs, the body is going to be wrecked. Rest the mind, repair the body. So you have diabetes. What you really need and want is to repair the pancreas. You don't want to wreck the pancreas. You don't want to damage the pancreas. If you're running your mind, you're damaging the pancreas. But if you're resting the mind, you're repairing the pancreas. So where are you going to find the solution for your diabetes? In your mind. Rest it. Don't run it. All right, we'll do a small meditation. Now, Little complicated, so hear me out. Those that have diabetes will think about their pancreas. Those that have cholesterol will think about their liver. Those that have the blood pressure will think about the blood vessels. So here's how it's going to be. When you, in your mind, you're going to repeat this. Run the mind, wreck the pancreas. Rest the mind, repair the pancreas. This is for the diabetic. Or you can say run the mind, wreck the diabetes, rest the mind, repair the diabetes. Those who have cholesterol, run the mind, wreck the liver. Rest the mind, repair the liver. Those that have blood pressure, run the mind, wreck the blood vessels. Rest the mind, repair the blood vessels. So the reason I want you to do that is to really make you fully aware of the fact that you have a way of repairing your pancreas, you have a way of repairing your liver, you have a way of repairing your blood vessels and controlling the three major problems of diabetes, cholesterol, and blood pressure through this. So we're going to do a simple meditation. Those that do not have problem with diabetes, cholesterol, and heart and blood vessel, they can just say, run the mind, wreck the body, rest the mind, repair the body. We are repeating this R, 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 R in our mind, okay? So when you take a breath in, you're going to say, run the mind, wreck the body. When you breathe out, because breathing in is sympathetic, breathing out is parasympathetic. Breathing out is relaxation. So run the mind, wreck the body. Then you breathe out, rest the mind, repair the body. So this is how you're going to do inhalation, exhalation. Inhalation, you're going to say run the mind, wreck the body. Exhalation, rest the mind, repair the body. In the beginning of this, I'm going to be with you. So be in a comfortable position. Breathe in, breathe out, breathe in, and breathe out. You're going to begin the meditation now. You're going to start inhaling, run the mind, wreck the body. Exhalation, rest the mind, repair the body. Inhale, run the mind, wreck the body. Exhale, rest the mind, repair the body. Let's repeat that 10 times. Gently open your eyes. Okay, so those of you, now I've done this different focuses on the breathing, on the pancreas, on the liver, on body organs. But those that have a mantra that they've taken from their Ishta or from the Guru about their Ishta, they can just repeat their Ishta mantra, whatever is their denominational mantra that they have taken from the Guru, repeat that in the brain. That has the same effect for the whole body. It's exactly the same thing. Okay. So we talked about the gut, right? And all these problems that we have in the body. Most of them, I told you, are between the pancreas, between the diaphragm and the pelvis. And that is where most of our focus is. And that is where the highest innervation of vagus is. And that is where you get the maximum benefit. So all these things that we do in Integrated Heart Center yoga program, eye massages, humming, Brahmari, chanting, pranayams, chest expansion, right? They're all designed to stimulate this vagus nerve that runs from your mind all the way down to your colon, to stimulate the vagal tone and get the benefit of vagal tone stimulation. Now, most of the things that I discussed with you, some may be complicated. You may need to go back on this video several times to understand the concepts. But the important thing is remember the A, B, C. The awareness resides in your mind. The inflammation resides in your body. The awareness has to percolate down through the bridge, which is your vagus nerve connected to your breath. By controlling the breath, you strengthen the bridge and you make the awareness percolate down to the body organs and get the calmness. Calmness is what heals the inflammation. A calm mind is what heals the pancreas, improves the diabetes. A calm mind is which heals the liver, improves the cholesterol. And a calm mind is which heals the blood vessels and improves the blood vessel. And a calm mind is which heals the heart and improves the blockages. Thank you very much.